Hello and welcome to Yoga with Nazareth. I am, of course, Nazareth, and this video is going to be a follow-up to pelvic floor pain. I previously posted two separate videos, and there's been quite a time span since I uploaded another one. And I want to be real honest with you guys, I lost my nerve a little bit. I shared those videos almost a year ago, I believe. And then I started to wonder, geez, should I be talking about this? Is anyone even interested? And recently, a few of you have sent me messages asking me, when is the next video going to be posted? And it really reminded me how important this topic is and how important it is for me to share my story, even if it just helps one or two people. So I ended that first video talking about a book I found called When Sex Hurts. This book was so crucial to getting me the proper help. It goes into depth about what pelvic floor dysfunction is, what are the symptoms, what are the treatments, and in the back it included a list of resources to use, and one of them is the National Vulvodynia Association. Yes, there is an association for your vulvodynia, in case you didn't know that. So it's called NVA for short. They have a website. I suggest you check it out. It's www.nva.org. And there is a directory on their website. And I was incredibly fortunate to find a specialist located in Philadelphia. So I called the specialist. I made an appointment. I was so incredibly lucky that my insurance covered it, and my husband actually made sure to take off work so he could take me. And I remember being pretty nervous for that appointment because I was terrified that they were going to tell me nothing was wrong and that it really was all in my head. So I was kind of a bundle of nerves getting there. But once I got there, once I was seen by the doctor, I could tell within minutes that this was different. The questions they asked me were very specific, particularly about where the pain was located, when did it start, how long does it last, what makes it worse, what helps relieve it, even questions about like my bowel movements. Do I struggle with constipation? Do I have pain in my low back or my hips? Things no one had ever asked me before. So the specialist first explained to me that they were going to inspect the external genitalia. So that meant they were going to look at the, labia, the perineum, the vulva, the opening, and she was sure to let me know each time she was going to make any kind of contact to that area. So before her hand or her finger touched any area, she'd let me know. In my case, the closer they got towards the vulva and the perineum, the more I felt pain, even just externally. The next part of the test was called a Q-tip test. Kind of crazy, but they literally get, like a little Q-tip, and they insert it inside the vestibule. And I should mention before that they do some internal palpitations as well. Again, just sort of mapping out what area triggers pain in my body, in my genitalia. So the Q-tip test, they place it in the vestibule on the 4 glands that reside there. Again, please watch my previous videos if you have no clue what I'm talking about. I explain it in depth in those videos. They put it on the Bartholin's glands and the Skene's glands. As soon as the Q-tip made contact, like my skin was on fire. It felt like acid on my skin, as I've described previously. Last but not least, there was some kind of apparatus that actually measures the muscular tension within your pelvic floor muscles. And when all was said and done, I want to say this was like maybe 10-15 minutes worth of examination. The doctor looked at me and said, well, honey, no wonder why you're in so much pain. You have vulvodynia and vestibulitis. And I remember my immediate reaction was I kind of blew it off. I had gotten so used to being dismissed that I sort of chuckled and I was like, oh, so you mean I'm not crazy? And the doctor looked at me so sincerely and she said, you are not crazy. This is so common, so misunderstood, and so many women suffer from this, and you're not alone. As you can imagine, it was so comforting to feel seen and heard for the first time in almost 3-4 years. She then proceeded to tell me what she believed to have caused this issue. Because I had an episiotomy, there was scar tissue that formed where the incision was made. When the incision is made, there's a little bit of a separation in the perineum, and then you're stitched back together. Ideally, everything's all in line. But in my case, when they stitched me back together, it was kind of like this. So it was all crooked, and therefore, all of the tissue, all of the muscle surrounding it got kind of knotted and torn up, and that's how that scar tissue built up. So when I was feeling pain during penetration or sitting, that's where it was coming from. The vestibulitis could have been caused by one of two things. It's very likely because of the scar tissue that formed in the perineum, that the vestibule just became more sensitive and therefore kind of became hypervigilant. Second possible cause was birth control. I had been on birth control since about 19, 20 years old, and she explained that there is research and studies showing that birth control is a direct link to vestibulitis. Because of the hormonal treatment, a lot of times it affects the lining within the vestibule, and the tissues again become sensitive and irritable. So I was instructed to stop my birth control. I was prescribed a topical treatment that included a hormonal treatment. I believe there were some steroids in there just to help with the inflammation, as well as a few other ingredients to sort of soothe and calm down the skin. The next item on the list was physical therapy. And I remember kind of chuckling. I was like, there's a physical therapist for your vagina? And she said, yes, there are physical therapists who specialize in pelvic floor therapy. This was exciting and also kind of bittersweet. I don't know how to explain it other than I was so relieved to get help, but I also was kind of like, you mean this help was out there this whole time and nobody told me, and I'm here suffering and in pain, and my husband and I are having intimacy problems, and it's because nobody knew any better? You know, it was kind of frustrating. Again, the doctor was so incredibly patient with me. She explained that gynecologists have very limited training in female sexual health. Their focus really is on the vagina and the uterus. They're essentially just bypassing these areas, not because they don't care, they really just don't know any better. So this really helped me understand why it had gone undiagnosed and honestly ignored for so long. So this really was the beginning of my path to healing. Stay tuned. I am going to upload the next video talking about my treatment, and there will be another one after that talking about surgery that I opted to take and how it has helped and where I'm at now. So again, thank you so much for watching. You guys can follow me on Facebook and Instagram. I'll include the links below. It's Yoga with Nazareth, and I talk about pelvic floor health. I talk about moving your body and yoga and kind of everything in between. And if you have any questions, please don't hesitate to ask. And of course, like, follow, subscribe, all that jazz. I thank you guys so much. And if you are experiencing pain, please remember you are not alone. It can get better.